Good afternoon, Enid. I'm Maggie Jackson with the Garfield County Health Department.
Hi, and I'm Ray Johnson with the Garfield County Health Department.
And Ray and I are sitting 6 feet apart, so we're going to go ahead and take our masks off because we're at a safe distance so you can hear us clearly. We have a update for you this Friday. We know it's been a busy week with lots of conversations, so we want to quickly just give you an update on what's going on with COVID. Are we only talking about COVID at the health department?
Sometimes it feels like it, but no, we actually have a couple other fun things going on, and if you follow the Garfield County Health Department on Facebook, you can see that we just launched some community exercise programs. We're partnering with the city of Enid for these, and most of them are free, and throughout the month of July you can do water aqua cardio at the Champlain Pool a couple days a week. On the Garfield County Health Department page, I share the schedule frequently, and we actually have a separate group that's Garfield County Community Exercise, where you can let me know if you're coming to classes or what you want to see. But then at the Champion Park Gym, it's on 10th and Chestnut, we have classes, let's see, Tuesdays and Thursdays at 5:30 in the morning, 3:45 in the afternoon, and then Wednesday afternoons as well. So check out that schedule and you can see what the classes are. And if you have any questions or anything, please ask them on the Facebook group or on the page, and I'd be happy to answer.
Thanks, Ray.
Yeah.
We want to continue to promote health in other areas as well. So we're excited. We know that nutrition and physical activity are some of the biggest ways that we can stay healthy, and we're still thinking about those other parts of health as well. And we really want to be a reliable source of local information for our community. We are going to start sharing more of the primary sources of data that we look at as public health professionals. We're trying to we are actually gathering the data points in real time. How many tests did you do today at the health department, or helped with today?
41. I helped with 200 on Wednesday. We tested about 39 people yesterday, and then this morning I tested about 40 people. Well, I helped the best.
Yes.
Yeah.
Yes.
Yeah. So
Our
Yeah.
Yeah, so we are actually collecting the data in real time. Our nurses are. Ray helps sometimes with testing. I've helped to get out there in the heat and help swab in people's vehicles. So every day at the Garfield County Health Department, you can call to make an appointment. On Wednesdays, we're doing large pushes where we're trying to catch up with testing. So we did 200 tests this Wednesday at the Garfield County Health Department. Lots of people ask about our rapid test. That is only available when we have a nurse practitioner on site who is available to use it as a diagnostic tool. So people who do have severe symptoms, or not severe, more symptoms, we're trying to get them into a rapid test result. Otherwise, our lab results are taking about 24 to hours to 5 days. It just depends where the lab sample, which lab takes it, and what their turnaround time is with the large volume of tests that they're getting at our labs across the state. Back to just some general updates about coronavirus in Garfield County. We today are reporting 144 positive cases. We still only have 2 deaths, and then we're considering 97 people recovered. I just brought up a few quick visuals. The next slide, Derek, is this is our epidemiological curve, and that is a long word. It's just to show you a trend of how our cases per week and per day look like in our community. We've had some spikes, and we are increasing still. The next slide shows a map of Oklahoma, and we are still considered a yellow county. We are not a high-risk county, but if you can see just south of us, Kingfisher has seen a lot of cases for their smaller population, so they have become orange. Oklahoma County, if you're coming back and forth from Oklahoma City, they are in the orange alert category. And I put the link to that website right there at the top. We'll put a link on our Facebook page maybe too, just because it's a good way to get a picture of where our state is compared to other counties. On the next slide, this is just to show you lots of people want to keep up with how many people are in the hospital. This is something we're looking at and talking with our hospitals about every day. So across the state, we have still 487. It's that yellow part at the bottom. That's how many people are in the hospital this week. So we are looking at about 13% of people who test positive for COVID-19 are having to go to the hospital. So this is something we continue to watch because our hospitals have shared with us that they do have some beds available, but that the staff and the supplies to take care of someone that is diagnosed with COVID-19 and is hospitalized, those are limitations that they're continuing to see. We know that Integra shared that their hospitals across the state are filling up. So we're communicating with them and trying to support them with education so that people don't end up going to the hospital with COVID-19. If you'd share the next slide, this is something we shared on Thursday at the City Council meeting that we just really helps us know that if you're a business owner, like this is a picture of two hairstylists. And that is the number of people they saw. Those hairstylists were infected with COVID-19. They tested positive. And they saw 139 clients while positive for COVID-19. Those two hairstylists wore face coverings, and their patients did too. So that's just a case study and a picture of someone who is really close up with their clients. If they have a face covering, it helped those 139 people not become infected. So we're continuing to educate about the importance and efficacy of masks. And it's a recommendation from the health department and from the city. So if you choose to wear a mask, you're doing your part to help not spread COVID-19 to others. And I think that was is there another slide after that, Derek? Okay, Ray is going to come in later and give us a demonstration about various masks. So we can skip to the next slide. And I wanted to bring up the topic of herd immunity. It's a complicated topic, but a lot of people mentioned it on Thursday. I'm sorry, it was Thursday. Yes. Where's my week gone? It's been a long week, you guys. On Thursday, we've had some conversations about herd immunity and what does that look like. When we have a virus like polio, we get a vaccine for it. Children do when they're very young. And so now at this point in our population, we don't have any cases of polio because even if someone doesn't have the vaccine, enough people in our communities have had the vaccine or have had polio at some point in their life, and we just don't have enough people to spread it. So for some viruses, it needs to be 80 to 90% of the population either has the antibodies for a virus, which means they've had the virus and their body is protected against it, or they've had a vaccine which does the same thing. It offers that protection against the virus. So for COVID-19, at some point in the future, we might have herd immunity. We might have enough people that are protected against the virus. This picture just shows that in New York City, we've seen in the news, lots and lots of people have had COVID-19. They're looking at 25% maybe at some point of their community, their population has had either the virus and might have antibodies. So if you just look at how many people would, all those dots represent a person that is protected against the virus. So that first circle is how many we would need to have that herd immunity. And if you look at New York City, that's representing how many people maybe already are protected against the virus, and it's just not enough. We can continue to have cases, but in the meantime, 80% of those cases may be mild illness, and 20% are going to be our folks that have severe illness, might be hospitalized, might die from the virus. So in the meantime, until we have a vaccine, it's a big conversation, but we want to talk more about those scientific points we're looking at, that in order to get to that immunity, it's a long road to get there. And we're just not at the point where we can protect our vulnerable people. So I wanted to touch on that and would be happy to answer any further questions as the best I can, or continue that conversation on Facebook. All right. So we want to bring it back to the topic at hand. It's a hot one. We are still talking about masks. And one thing that, the conversation with the city, a lot of it is about how we apply that policy to the population as a whole. But when it comes to how masks work, public health research and evidence is showing us they still really help. They are something we want to promote. And in our schools and in our workplaces, they can be an effective way for our community and our population as a whole to help each other not spread the virus. So we want to be continuing to share what we've learned. I've had a lot of conversations with friends and family this week that actually, we have had recommendations come out in the past, and the science has grown as we learn more about the virus. And I myself had been to events without a mask on. I'd been out in the community not wearing them. And once I learned, because I'm in public health and see every day with this information, how it's growing and how it's changing, I personally became more convicted in the last couple weeks about how a mask could help me from spreading the virus. And so I have more recently worn my mask more often now too. So I just think that as we learn more and as this new situation changes, we're all taking that information and doing our best to apply it. So I want to be in that conversation with you all, and we're going to keep sharing those good resources on our Facebook page, so that if you're the type of person who wants to dive into it yourself, if you want to get to the root data, if you like to read up on the science, we want to help you get there and help you see what we're reading. So look at our Facebook page. There's a couple studies I'm going to share. Not everybody will want to read them, but some of you out there, you want to get to the root source. So we want to help you do that. So join us on Facebook for that. Give us a demonstration. I'll help her with that. And then we'll try to answer any questions that might pop up as well on Facebook.
So I just wanted to talk a little bit about all the different masks, because even for me, a public health professional, I'm good at research, and it's still kind of daunting to be like, what mask do I wear for which purpose? And, are all masks the same? And they're not. And I brought a bunch of different kinds and some information, and all this information either comes from the CDC, the FDA, or OSHA, and these are all science-based organizations that use research and facts to give these recommendations. So I'll kind of work up from the bottom and go to the most protection. So I'll start out with, so these are all the same level. So this is going to be like your cloth face covering that Maggie and I were wearing, that you can make. And a cloth face covering is actually the same as a non-surgical mask. And so I actually learned this today because I just assumed that this was a surgical mask. This is still just called a face mask. You actually can read on the box or the package if you order a bunch of these, and it'll say non-surgical. I'll show you what a surgical is in a minute. But anyway, so these masks are, the purpose of these is to protect other people. So they may contain large droplets. So if you want to show us both. So me wearing a mask and Maggie wearing a mask really honestly protects us both a lot. If Maggie is to take off her mask and say she coughs large droplets, this is most likely still going to protect me. If I cough, Maggie will be protected. So that is your non-surgical face mask and your cloth face coverings. And then this one is my favorite. It's a little bandana, and I can just pull it up and wear it around my neck, and then I always have it. Another really important thing is to remember that cloth face coverings need to be washed. You should wash your hands before you put it on and wash your hands right after you take it off. Wash them every time, and then the surgical ones are really only a non-surgical face masks are a one-time use. So now I'll go to a surgical face mask. And that looks like this, and they have these fancy ties and go like this. So surgical face masks and N95s and any other kind of respirator are still in limited supply. Our PPE really has increased, but these are asked that they're saved for healthcare professionals that need them to protect themselves while they're at work, not for you and I going to the grocery store. These are just for professionals that need them. So the difference between this and this mask is, so this one just goes around your ears here, and there's plenty of space for things to enter. So you have the surgical face mask. A surgical face mask is tied around and around here. It provides a tight seal, which would prevent, if I was performing surgery or working in an emergency room and there was a splatter, I have more protection from that. And it also still works to protect the patient or the individual not wearing the mask. Is that making sense?
Sure.
I'm not missing anything? Okay. And then we have our N95s, which is the, well, there's several parts to this. These provide the most protection. They, it has these straps, which I'm not going to put on because I'll never get it off, and I wore it all morning, but these have a firm nose grip that goes around your nose, and it protects the wearer and other people around. And this N95s have to be, you need to be tested to see if it's a proper fit, and then so they're moldable around your nose, and then you have to do this test basically that determines if particles can get in there or not. Because if you just wear an N95 off the rack, it's still very likely that droplets will get in. So that's another thing. Just buying these and wearing them doesn't give you full protection. But the N95s are the best protection that you can have, along with a face shield. So yeah, am I missing anything with the face?
A good summary.
Yeah, yeah. Short and sweet. There's a lot more that can go into it, but the real important thing to remember is that wearing a cloth face covering is proven to protect those around you. And this graphic just kind of shows the difference between, so if I wear a mask and the person around me coughs, I guess, is that what this is? Mm-hmm. I'm going to look at it from here.
Yeah. Even speaking. This is
Oh,
speaking.
So this is just speaking. So when you're speaking, that many droplets are headed out and can easily infect a person. But if you're wearing a mask, that works to contain all that and would contain all those droplets and not get the people near you sick. Sorry guys, I'm doing a bad job with this one.
You're doing great.
But, yeah, and then this chart right here just kind of shows the low risk, medium risk, and high risk. So the highest risk situations are when no one's wearing a mask, and then, the greater distance between you and a person, and if everyone's wearing a mask, the less likely we are to get sick or to pass things on to people that we just don't want to. Because you or I might be fine, but I have family members, I know people that I want to keep safe, and so I'm just trying to do my part and wear a mask. And
yeah. Something we could share about that high or low risk is if you have a positive case of COVID-19, we are asking everyone to help us just let the people that they might have exposed know that they might have exposed. So we make calls to those contacts, and we don't tell them who it was that might have exposed them, but it lets them know that they should come get a test and that they should quarantine if needed. So if you were around someone that was wearing a mask and you were closer than 6 feet and you were for 15 minutes or more, if they had a mask and you had a mask, you are not considered a high risk for being exposed to COVID-19. You would not have to quarantine. If you didn't have a mask and they didn't have a mask, we would call you and let you know you are high risk for being exposed to COVID-19 and you would need to quarantine. So that's the part of what would happen too, that quarantine means we might ask you to work from home. And some people don't have the ability to work from home. So this is a tough ask for folks that are working hard and need their job to provide income. So we want you to know that if you're wearing that mask and you get a call that you were maybe exposed, that you might be able to not have to quarantine. So that's what that low risk means for you. If you are exposed to COVID-19 and you had a mask on, you wouldn't have to take those extra steps as someone who didn't have a mask on. So that was a little unclear too, but we're trying to explain that side of things. Where one of the big goals we have is contact tracing. We're trying to ensure that people know if they have a need to get a test, if they have a need to stay at home, and keep others safe. So.
I actually wanted to add something onto that. I had a conversation with some folks in a different county the other day, and they weren't aware of this. If you get a call that you were a contact, we ask you to quarantine for 14 days. You are welcome to get a test. We'll gladly test you. We usually recommend to wait 5 to 7 days after the contact to get tested. But even if those test results come back negative, you are still asked to quarantine for the rest of the 14 days. So you could be tested on the 10th day, on the 11th day, and get a negative result, but you could still on that 14th day end up being positive. So if you have been in close contact with someone, which means closer than 6 feet for longer than 15 minutes, then you would need to stay home for 14 days. So that's something that there's been some confusion about.
Great. Well, we're thankful for the City of Enid allowing us to share an update, and we wanted to know if there's any questions on Facebook that we can try our best to answer.
Now, there is one question. When you were talking about masks, there was a question about 3D masks.
3D masks?
If you know anything about the 3D masks.
3D mask. That's something I'm not familiar with. We would love
I
to
would
take
love
that back
to,
in
yeah.
more.
3D printed face masks.
Oh, okay, cool.
Oh, so they were like 3D printed specifically to
your
a person's face. That's something that I would want to research more before I answered.
I've heard about it,
Yeah.
people working on those, and I think that there is some benefit to having it very tight fit to your face. That may not be something that's accessible to a lot of people, so we'd be happy to go back and look more up about that.
Okay. And that was the only question on Facebook.
Okay, great. Thank you, guys.
I'm going to look into that, though.
Yeah. We're learning
Yeah.
every day so much, too, right along with everyone. All right. Well, that's what we have for you today. Thank you so much if you followed us on Facebook and listened, and we hope to continue to provide reliable information, and you guys stay safe and have a great weekend.
Bye, Enid.